So thank you very much for inviting me to talk. So as already said, I'm Sabine and I work at the OECD in Paris. And I'll be sharing some of the results from our report, Step Up, Tackling the Burden of Insufficient Physical Activity in Europe. Now, I wanted to start with a very quick introduction to the OECD because we're generally better known for our economic analyses and not so much for our public health work. But we do work in public health and we focus on three main areas. There's prevention of chronic diseases, where we look at all different kinds of lifestyle factors, including physical activity. We look at infectious diseases, where we look at antimicrobial resistance and COVID-19, of course. And we look at strengthening public health systems. And in general, we always try and give policymakers the evidence to make the economic case to implement certain public health policies. So we look at, does a policy actually improve health and well-being? But also, is it a good return of investment? So how much does it cost and how much does it return in economic benefits to a society? So today I'll be talking about the report that we launched together with WHO Europe on physical activity in Europe. The report does not particularly focus on women, but I have kind of pulled the main messages from the report that are relevant for women. So primarily, and I'm sure after all of the presentations today, you've heard this a lot, but physical activity has a lot of benefits. And these go beyond kind of weight loss and disease prevention. Physical activity has been shown to improve sleep, to reduce depression, to improve mental health and cognitive health. It prevents falls, it increases the strength of bones. So it's really an all-around good thing for your health and for your wellness. And yet we find that in Europe, there's a very high prevalence of insufficient physical activity. So we found that 1 in 3 adults in Europe do not meet the WHO physical activity guidelines. And half of all adults never do sports or exercise. And these results are even worse among women. So across Europe, we found that on average, 4 in 10 women are insufficiently physically active, versus only 3 in 10 men. And this difference is consistent across all different countries. So the gap is smaller in some countries bigger, but in all countries in Europe, women are less physically active than men. And when we look at young people, this effect is actually even stronger. So on average, 18% of boys are at least physically active for an hour a day, and only 10% of girls. And again, we see the same difference in all countries in Europe. So it's a very consistent finding that women are less active than men, and it already starts at a very young age. This data looks at exercise and sports particularly, and then at other physical activity. So other physical activity could include things like cycling to work or gardening. And in both these categories and across all age groups, which are the bottom axes, women are less active than men. And we again see the difference in the younger age groups is really pronounced between male and female. And I mean, the data is still a bit difficult to say because we're still waiting for the large kind of international surveys to come back. But all evidence seems to suggest that the COVID-19 pandemic has actually worsened this situation. So a survey that asked women what they did in terms of physical activity during the pandemic showed that 19% stopped being physically active altogether, and another 34% reduced their physical activity. On the other hand, only 9% increased their physical activity. The survey also asked whether after the COVID-19 pandemic, women had plans to increase, and only 7% of women said that they were planning to be more physically active after the pandemic ends. So how much should we be doing? So the WHO recommend that we do 150 minutes of moderate intensity physical activity or 75 minutes of vigorous intensity physical activity. And this doesn't need to be a run. So it can be a run. It can be a 30-minute run at 10 kilometers per hour, twice a week. But it can also be walking the dog every day for half an hour, or mowing the lawn, or learning how to tap dance. So physical activity is much broader than what we really think about when we think about exercise. And so what we found in our analysis is that if everyone were to meet these minimum guidelines, we could prevent nearly 12 million cases of non-communicable diseases by 2050 in Europe. And this includes about 3.5 million cases of depression, 2 million cases of ischemic heart disease, diabetes, dementia. There's a whole lot of diseases that could be prevented by increasing physical activity. And what we also found is that due to the high burden of physical inactivity among women, these disease cases are disproportionately affecting women. So of all the depression cases that are due to insufficient physical activity, 71% are among women. Similarly, for dementia, 64% of all cases that are due to low physical activity are in women. And for cardiovascular disease, 48% is for women. So this is about half-half. But I have to say here that, of course, cardiovascular diseases are more likely generally among men. So here, women are overly disproportionately affected by this as well. So it really is a significant issue, the fact that the physical activity is low in the population as a whole, but particularly among women. If we were to increase physical activity in the population and meet the minimum requirements set by the WHO, life expectancy, so the overall life expectancy of the entire population would increase by 7.5 months. 7.5 months of the people who are currently insufficiently active. And the overall life expectancy of the population would increase by 2 months. Importantly, we also find that increasing physical activity would save 8 billion euros every year in healthcare expenditure across the 27 European Union states. So this is a very large financial incentive for policymakers and any other stakeholders really to invest in physical activity policies. So what kind of policies do we have? So there's actually a very wide range of policies that can be used to increase physical activity in the population. The report presents a lot of case studies. So we've short descriptions of case studies from across Europe. And right now I'll just kind of describe the high level categories that they fall in. So first up, there's school-based interventions, and this is very important to address physical inactivity among young people. And this includes physical education classes, but it also includes making school breaks more active and increasing after-school activities, and even transport to and from school. So there's really a range of points in the day where we can try and increase physical activity for children. Similarly, for people like me who spend 8 hours a day in an office, workplace-based interventions are important. We spend a lot of time in the office, and how can we make that more active? The healthcare setting has an important role to play. Firstly, of course, by providing behavioral counseling, trying to convince people to be more physically active by explaining why it is important. And in some countries, there's actually the opportunity for doctors to prescribe physical activity. So they are able to give a prescription to a certain exercise class and tell someone that they can go there and there. And in some cases, it's even covered by insurance. And this way they can really contribute to increasing the physical activity levels. The sports sector has an important role to play, obviously just by providing infrastructure so that sports is possible, but also through programs to increase participations among certain groups. So it can be among women, but also among minorities, children. The fifth category we found in terms of policies to address physical activity are policies that target the urban design and the environment that we live in, and these include transport policies. And this is about how do we ensure that people can be physically active outside? How do we improve road safety so that people can go and cycle? How can we increase the number of parks where people can go and exercise? And finally, there's information and communication policies. We need to tell people why they need to exercise and how they can do this, how much they should be exercising. So one example of this is physical activity guidelines. A lot of countries are already making this, a lot of governments. There's campaigns as well, so just mass media campaigns, online campaigns. But it can also be more local interventions, such as an app with information about all the available classes in a certain region. So what can be done to increase physical activity specifically among women? I think I've pulled kind of 4 main themes, just judging from the reports. I think firstly, it's very important to start young. Again, going back to what the data shows us is that already at a young age, women are much less active than men. So it's important that we get in early, and physical activity in school is a very important part of this. Again, this can be part of the curriculum, but it's also during breaks and after school. Secondly, we need to remove barriers, and this includes understanding why women are less physically active. And then creating programs that are inviting to women or maybe even catered specifically to women. The report has an example of sports clubs for health. And it's the idea that sports clubs move from being kind of focused on competition to being focused on sports for health. And this might be that they start specific classes for beginners or specifically for women, or just think about how they can make it more inviting for everyone to participate in sports clubs. Thirdly is, I think, very important is making it safe. Women are probably more likely to stop exercising if they don't feel safe outside or if they don't feel comfortable somewhere. And one way that we can achieve this is by involving women in the planning of urban design. And this is actually a very important part of the Impala guidelines, is actually involving all stakeholders in these kind of design questions, because we need to really understand, this goes back to the presentation we saw before as well. We need to understand who is using these outdoor exercise places or cycling lanes, and understand what their barriers are and how we can make it safe for them. And finally, we need to understand our audience. This means when we do campaigns tailored to get it to women, to making them more active, we need to understand them really, like what is holding them back. And I want to show a quick example, which is actually not in the report, but I personally really like it as an example. It's a campaign from the UK, and it's called This Girl Can. And it's focused on women, trying to get them more physically active, but it's really trying to address the issues that women specifically have. So it might be about women being nervous about going to the gym, or getting back after having a baby, or being able to fit it into their life. So it's really trying to understand what are the issues or the barriers for women, and how can we address these. In addition to the kind of the mass media campaign targeting directly for women, they also have resources for other stakeholders. So they have information for leisure spaces, so kind of sports clubs, how they can be made more safe and welcoming for women. And they have information for physical activity lessons, so in school, how these can be made more enjoyable for women as well. So I think this is a really good example of before we can try and increase physical activity among women, we need to understand what's keeping them from being physically active. It's not an issue of just saying, look, you should do more physical activity. And finally, coming from an economic organization, I want to finish on an economic note. We've done some modeling, and we've looked at the economic returns of physical activity. And what we found is that for every €1 invested in a physical activity policy package, so this is a package of different policies to increase physical activity, €1.7 are returned in economic benefits. And so this is from reduced healthcare expenditure, but also from a more productive workforce and people that are more productive at work, more likely to be in work. So overall, investing in physical activity policies isn't just doing good for society, it's good for the economy as well. And I think that this is very important as a message to bring out there. As I said, this is the report that the presentation is based on. It has a lot of case studies, which might be of interest. And if there's any other questions, I'd be happy to answer them as well.